Hello, this is Dr. Terrence Baker coming to you from the studios of NABN TV, Doctors in the House. Today, Queen Elizabeth is in the news. As the longest reigning monarch of over 70 years on the throne, Queen Elizabeth has been identified as being positive for COVID-19. Currently, she is 95 years of age, has spent over 70 years ruling and governing England, and is an important world leader in stabilizing the world and certainly England. You recall that Boris Johnson became the first major world leader in March of 2020 when he became infected with COVID-19 and required intensive care unit care and had a near fatal experience with COVID. Queen Elizabeth and Prince Philip received their COVID-19 vaccine in January of 2021 and recently received a booster. The Queen's infection, while mild, and the Queen is reported to still be carrying out many of her basic work functions each day this week, gives us an opportunity to review some basic principles. The world is coming out of restriction and reopening. Nations and states around the world are removing their restrictions for isolation, quarantine, and mask wearing. As this occurs, it is important to realize that science rarely involves all rules and all regulations, where everything in our lives are regulated about COVID, and rarely does it involve taking down all rules and all regulations. Instead, the middle ground is where we need to be. The middle ground will keep you and your family safe and will provide a minimized chance of getting sick yourself or transmitting COVID-19 to family members, friends, neighbors, relatives, people that you work with. What is the middle ground? The middle ground involves vaccination as a foundational step to staying safe and to ensuring that you have protection against hospitalization, intensive care unit admissions, and even death. The vaccine will not keep you from getting sick, but it does appear to keep you from being hospitalized and will reduce your chances of being in the intensive care unit and dying. Next are boosters. It's important to stay boosted as recommended by medical leaders, community leaders, who will from time to time be recommending boosting in order to ensure that your level of protection is sufficient to, again, minimize your chances of getting sick, requiring hospitalization, and dying. We know that the vaccine's effects last for 2 to 4 months and then begin to decrease over time. It is believed that boosting from time to time will be necessary at this time as we continue to understand this virus and its mutants, that boosting will be an important part of continuing your protection going forward. If you're due for boosting, I would recommend that you make arrangements with your local pharmacy or physician, healthcare clinic to have your booster shot obtained. Next is N95 mask. During the course of this pandemic, doctors have realized that cloth masks, even 3 to 5 layer cloth masks, handkerchiefs, other materials do not provide sufficient protection from viruses like Omicron or son of Omicron, which are the predominant mutant strains at this time. It's important that if you're going to wear a mask, if you're in an environment where you need to protect yourself and or protect others around you, it is important to use a KN95 or N95 mask, as this is the only mask that will provide sufficient protection for you and those around you. Next is filtration. Filtration is an important part of reducing the virus in your environment, and it's important that your air be filtered in a way that allows the virus to be trapped and removed from the environment. Also, ventilation, that is to exchange the air in your environment, either your home or your place of work, on a regular basis. The CDC recommends that air be exchanged at least 8 times per hour, where it allows reduction of the virus particles that are in the air or might be in the air to be removed. Next is avoid crowds. In a crowd of people that you know or don't know, either from home, work, or social events, it is likely that one or more individuals in the crowd will be carrying or sick with the Omicron or son of Omicron virus. You recall that Omicron and son of Omicron often start as a mild cold, which many people mistaken for cough, cold, runny nose, seasonal infections, seasonal allergies, or just environmental factors causing nasal congestion, a scratchy throat, some body aches, little night sweats. People mistake these symptoms for a spring, fall, winter cold. And so in a crowd, it is likely that one or more individuals will be carrying or actually sick with Omicron or son of Omicron. Next is avoid close contact. All of us, having been closed up, want to greet people we haven't seen in a while with hugs and kisses and handshakes and close contact. However, for now, that contact needs to be minimized. The reason being is that close contact promotes the spread of Omicron and son of Omicron. These two mutants are extremely infectious and are very easy to give to someone that you have close contact with, and can be on the clothing, on your clothing, and can be transmitted to those that we love. Same with handshakes, kissing, hugging, those type of behaviors, all are opportunities for Omicron to move from the individual that's infected to you. Also, avoid closed spaces. Closed spaces where there's not adequate filtration, not adequate ventilation, provide an opportunity for you to become infected. Early in the pandemic, many infections seem to have occurred in bars and restaurants and churches because of close contact and closed environments. So it's important to recognize that if you're in a closed environment for business or for celebrating life, it's important to wear a KN95 mask if you're not sure about filtration and ventilation of the space that you're in. These simple rules will help to keep you and your family safe. These simple rules, the middle ground, is a compromise between closure and mandatory restrictions and reopening the nations and the states of the world. The son of Omicron and Omicron do in fact have some serious consequences. And in fact, son of Omicron appears to not only be 5 times more infectious than its neighbor Omicron, it appears that it also has some more serious consequences associated with the ability to hospitalize, require intensive care unit care, and even death. So it's important to recognize that son of Omicron does in fact appear to have some capabilities of causing serious injury and serious harm. If you're visiting someone you love, like Queen Elizabeth, who is a vulnerable citizen, a vulnerable family member at the age of 95, it's important to wear your KN95 mask while you're visiting, or to have your family member, friend, relative to wear a KN95 mask while you're visiting. It's important that we continue to protect our vulnerable, that we continue to protect those around us that are perhaps more easy to become infected by the son of Omicron with its more challenging complications, including hospitalization and even death. This is Dr. Terrence Baker coming to you from the studio of NABN TV, Doctors in the House.